Welcome, everyone, to this open forum for care for kids and families. Just while we're waiting, a couple more minutes for folks to join. If you could add your name, affiliation, and preferred pronouns to the chat, we'll get started soon. Looks like we have a pretty good group here, so we'll give it maybe just one more minute before we officially get started. And thanks to everyone who's adding their names in the chat. Okay, I think we can go ahead and get started. So welcome, everyone. We're going to officially begin the forum now. Thank you for joining today's open forum for care for kids and families. I'm Maggie Fenwood Hughes, pronouns she, her. I'm the research manager at CoLab, and I'm just going to be opening things for us here. Just to note, this is going to be recorded so that we can share with those who weren't able to join today. You should have received a notification. So on behalf of our team, I just want to thank you so much for being here, and we're really excited about today's session. I would like to begin with a land acknowledgement. CoLab for Community and Behavioral Policy in the University of Washington acknowledge that we gather on Indigenous land, the traditional territory of Coast Salish peoples, and specifically the Duwamish tribe. This is ancestral land, is unceded, and must be returned. We also acknowledge that our work across the state takes place on the homelands of Native peoples who have lived in this region for time immemorial. Currently, there are 29 federally recognized and 7 non-federally recognized tribes within Washington state. We express our deepest respect for and gratitude towards these original and current caretakers of the region. As we move forward in advocating for and moving towards health and racial equity, let us remember that we are living in a history-driven present. Let us work to learn more about the histories, cultures, and traditions of the Indigenous people and how we might build relationships with sovereign tribal nations and create more inclusive spaces that foster innovation, collaboration, and empowerment. We encourage you to consult native-land.ca to learn more about the land you are on and to pay rent through Real Rent Duwamish. The Duwamish tribe has yet to be justly compensated for their land resources and livelihood, and by paying real rent, you can do something today to stand in solidarity with the first peoples of this land. All funds go directly to Duwamish Tribal Services to support the revival of Duwamish culture and the vitality of the Duwamish tribe. Thank you. So we'll move on to some Zoom logistics. Just before we begin, if you encounter any technical issues during the meeting, or just want to express thoughts or reactions to the speakers, please send us a message to the chat box. You're encouraged to put thoughts and reactions in the chat throughout the presentation. We will have a Q&A session towards the end, so feel free to put your questions directly in the Q&A box at the bottom of your screen throughout the presentation, or use the raise hand function once we get to the Q&A portion, if you'd like to share your question verbally. And then lastly, just because this is a Zoom meeting rather than a webinar, it's very easy to unmute. So just ask that you pay special attention to keeping yourself muted unless asked to unmute by presenters. So We will be recording this and uploading it on our website. So now I'd like to hand it over to my colleague, Dominique Smith, who will be leading us in an opening activity.
Thank you, Maggie. Good morning, everyone. My name is Dominique Smith. I use she, her pronouns. I'm a continuing education specialist at the UW CoLab and ASHE, which stands for Allies and Healthier Systems for Health and Abundance in Youth, both housed within the Department of Psychiatry. I support the CARE project with partner engagement and community outreach. I'm honored today to guide you through a 3 centers check. So, as we get ready to be grounded into this space, this is an invitation, completely optional. This is a centering meditation that is designed to be used just as a short break in your day to help you refocus your mind and come back to the center. Calming your mind and allowing yourself to feel more compassion and kindness to yourself and others. Doing a quick centering practice will help you to become more in tune with your body and notice how you feel. Again, this is an invitation to join this practice. So I invite you to begin by closing your eyes or lowering your gaze. And take 2 to 3 deep breaths at your own breath's pace. So if you can, inhale through your nose and exhale through your mouth. Take a moment to let your thoughts settle. Your thoughts may be scattered, which is perfectly normal. The mind is always at play. Give yourself compassion in this moment right now. So I invite you to think of 3 words to describe how your heart, your mind, and your body feels. You're not going to share this with anyone. It's just a moment to reflect. So first we'll start with your heart. How is your heart feeling? Is it heavy, grateful, or maybe it's racing? Next, think about your mind. Are you focused? Maybe distracted? Are there thoughts swirling around? Maybe you're ready for the holiday weekend. And lastly, how does your body feel? Maybe you haven't had lunch yet and you feel hungry. Are you tense? Or possibly refreshed? Settle in your thoughts. The most important thing for you to do is to pause and enjoy that pause. Have a moment to reflect in this space. There's no judgment at all if you can't focus, or if you're unable to settle, or if you can't think of 3 words in this moment. I invite you to take 2 to 3 more deep breaths at your own breath's pace. And if you close your eyes, you can open them. We appreciate who you are and how you've arrived today. Again, this practice is called the 3 centers check. Just a simple practice of checking in to cultivate a gentle, effortless awareness of the heart, mind, and body. Thank you.
Thank you so much for that, Dominique. I really needed that. That was amazing. Thank you. Hi, everybody. My name is Sarah Walker. I'm a psychologist and I'm faculty in the Department of Psychiatry. I play an oversight role on the CARE project, and I'm going to be guiding us through the open forum today. I first want to acknowledge the many, many people who are part of this effort. So if we can go to the next slide. I want to start with our co-design team. Our amazing co-design team makes decisions for the content of this project. This includes the principles and the core elements of training that are the foundation for all of the products that we're developing. The team is facilitated by the talented Dana Perlman and Sue Grinnell, who are trained in systems facilitation and work with organizations like the CDC throughout the United States. Next slide. Our advisory team is a resource for the co-design team. The advisory team has been meeting quarterly and providing advice on approach and content. Next slide. And our project amplifiers are organizations and individuals throughout the state who send CARE project newsletters and invitations to give feedback through their own networks. We also have a community sounding board that reaches community members throughout Washington state that we will talk more about in the presentation. So our team really wanted to make this open forum conversational and have it feel personal. And we have individuals from the co-design team and advisory team who have generously agreed to comment on and also critique this process. But to give you just an overview of the project as a whole, we have prepared a short video. So then we can spend more time in this open forum digging into conversation with our partners and with you. So please enjoy this short video to kick us off.
Care for Kids and Families is a statewide effort to improve the cultural responsivity of child and family mental health services while centering youth, caregivers, and community members with lived experience throughout the design process. This video traces the first year of CARE, why and how we came to be, and where we're going next. CARE began when multiple policymakers and treatment providers came together to identify the top needs in our state's publicly funded children's mental health system. Many priority areas came up in discussion. However, when participants were asked to identify the most urgent need that would improve the children's behavioral health system right now, the answer was clear: expanding culturally responsive care. We are in a child mental health crisis, and this is...
Hi, team. Does someone want to give an update on what might be happening with the video?
Okay, so it stopped playing because it was playing, so I didn't know it had popped. Okay.
It wasn't playing on our side, Maggie.
Yeah, it hasn't played, Maggie. I don't think we're seeing your screen, Maggie.
I stopped sharing because, yeah, let me start again.
Here, I think I'll stop sharing first, Maggie, and then I think you can take over from there.
Care for Kids and Families is a statewide effort to improve the cultural responsivity of child and family mental health services while centering youth, caregivers, and community members with lived experience throughout the design process. This video traces the first year of CARE, why and how we came to be, and where we're going next. CARE began when multiple policymakers and treatment providers came together to identify the top needs in our state's publicly funded children's mental health system. Many priority areas came up in discussion. However, when participants were asked to identify the most urgent need that would improve the children's behavioral health system right now, the answer was clear: expanding culturally responsive care. We are in a child mental health crisis, and this is hitting families of color particularly hard. Because of systemic racism, people of color are more likely to be economically disadvantaged and therefore are enrolled in Medicaid at disproportionately higher rates than white people. This means that BIPOC families are also disproportionately impacted by workforce shortages, and it's critical that publicly funded behavioral health organizations are providing culturally informed and relevant care. The goal of CARE is to expand and increase diversity in the mental health workforce for Medicaid services, to support the existing workforce to deliver culturally responsive care, and to empower clinical directors and managers in supporting these two innovations. We're using a strategy called policy co-design that draws from collective wisdom and systematic knowledge to design a product that works for Washington State families. Our policy co-design strategy is centered around 3 levels of involvement. Our core co-design team leads the project design by integrating different knowledge sources and bringing lived and professional expertise from multiple lenses. Our broader advisory team has brought additional layers of expertise and provided valuable feedback throughout the design process. We've also gathered public input through our community sounding board, volunteers from across the state who have helped guide the initiative through feedback surveys and activities. We've pulled information from a variety of sources, including listening sessions, systematic research reviews, and strategic questions posed to our community sounding board and advisory partners, prioritizing knowledge from those with lived experience interacting with our public systems as well as subject matter experts. Our co-design members are the information integrators of the project. Through regular facilitated meetings over the course of the past year, our co-design team members have developed a new model for culturally responsive care. As of May 2023, we've confirmed principles of culturally responsive care to guide all 3 goals, developed a training outline for the existing workforce, and gathered information about policy pathways for an expanded workforce. In the next year, subcommittees will finish product development for training the existing workforce, training community health workers to support child and youth mental health care, and coaching organizational leaders to implement the first 2 innovations. We're also partnering with policymakers and advocates interested in finding the policy pathways to pay for this workforce expansion. We plan to begin to pilot these materials in the spring of 2024 throughout the state. As we move forward, there will continue to be plenty of ways to be involved with this project. Visit uwcolab.org/care to learn how you can join our community sounding board, advisory board, become a project amplifier, or join a subcommittee. Thank you for your interest in Care for Kids and Families. We believe that through this program and with your help, we can increase and improve mental health equity in Washington State.
Great, thank you so much. And particularly thank you to Rachel Porter for pulling that together, communication specialist, who you're going to hear more from in just a minute. So I'm going to do a little overview of our forum agenda. I'm going to start by just reiterating a few key milestones from the project to this point. And then I'm going to be joined by Avriel Jacobson, who's a children's mental health planner for the King County Behavioral Health and Recovery Division, to also comment on the goals of the project. We'll then highlight some of the efforts from the communications team and our effort to reach the entire state of Washington in this work. And Rachel, again, our communications specialist, will present this effort. Dominique Smith, who guided us through the opening, will come back to reflect on how to build reciprocal partnerships, and we'll include some examples from the partnership engagement team work. And Dominique will be followed by Dr. McKenna Parnas, who will share some highlights from a large scoping review of the literature on community member mental health workforce roles and our efforts to set up listening sessions in non-English speaking communities in partnership with the New Americans Alliance for Policy and Research and other groups. I will then come back on, but just briefly, to talk about our work with Accountable Communities of Health and the Behavioral Health Institute to begin planning for implementation across the state. We will then be very fortunate to have Carolyn Cox and Gabriel Hamilton from the Spark Peer Learning Center and our CARE co-design team members to comment on the process and what they see as necessary for supporting child, youth, and family mental health in Washington state. And then we are also extremely fortunate to hear from Dr. Benjamin Danielson, a nationally renowned pediatrician and thought leader in health equity and youth wellness, the director of ASHE at the University of Washington, and a CARE project advisory member. We'll then open up for your comments and questions. Moving to the next slide. So as noted in the video, CARE emerged from asking multiple sectors what is an urgent need not currently being addressed in Washington state. The priority topic from this process was evidence-informed, culturally responsive care with a focus on expanding the mental health workforce. With an initial smaller planning team, we further refined these into 3 project goals. Next slide. These included supporting an expansion of the child and family mental health workforce to include community pathways into mental health support and service delivery roles, supporting the cultural responsivity of the existing and master's level public mental health workforce, and providing organizational support to public mental health agency leaders to adopt these shifts in practice. Next slide. The CARE project is projected to extend for a total of 5 years to reach our hoped for scale across the state. We have funding secured for the next 2 years, thanks to the generosity of the Washington State Legislature, which will take us through pilot implementation in at least 4 regions across the state. Next slide. I'm not going to read these all in detail, but we wanted to give you a snapshot of the progress as information gathering and information synthesis is starting to wrap up for each product area, and we're moving to develop these different resources. Next slide. I did want to highlight a real significant achievement for the project. Informed by over 100 community members statewide, our advisory team, and a scholarly review of culturally responsive frameworks being used throughout the world, the co-design team has finalized the key elements of service delivery for culturally responsive care that will directly inform training and organizational support materials. Next slide. And then before I hand it off to Avriel, I wanted to say a quick word about why we are spending all of this time on information gathering and relationship building. It could feel wasteful because, as the video said, and we all know, we are in the middle of a child mental health crisis, and we absolutely need to be doing things right now to address it. I want to say I feel this both professionally and personally, and there's absolutely things that need to be done immediately. For example, raising the public mental health worker wage, and the state's already taken action on and is continuing to look at. And then at the same time, a sense of urgency can be in conflict with taking the time to really deeply listen and understand. And I think that the lack of time that's gone into some of these activities, and I'm speaking for my own work here, not calling out anybody else, is at least partially responsible for why we find ourselves in this crisis. So while I don't pretend, and I don't think our team would pretend that we've gotten this all down perfectly, the CARE Project is really committed to doing the best that we can to listen and learn from families and youth seeking and receiving services, and to the mental health workforce. The co-design process we're using is a type of listening with purpose that moves through intentional stages toward a final goal. So I'm going to hand it off now to my colleague Avriel to reflect on these goals. Avriel.
Good morning, everybody. It's good to be here with you. I offered to, as one of the members of the co-design team, not the planning team, not the other teams that are all contributing, to just share a little bit of kind of the flavor and sensibility and some of what we've talked about. One of the things that we keep coming to over and over again is that the kind of change that this project is aiming for is something that takes time. It's not a one and done kind of effort. You know, I keep thinking about, in the 60s, we had a phrase that said, if you're not part of the solution, you're part of the problem. And definitely it's a little bit too dialectic and either or for my taste. But the basic gist was you need to get up and contribute to the effort, not just complain about it, not to just complain about the issues, which is sort of what's part of motivating me to participate and be involved in this effort. Some of the other things that we've talked about a lot are the need to disrupt our previous habits about how we go about responding to crises or problems, or how we go about solving what we identify as problems. And so Sarah talked about this a little bit, but we're also very much talking about in our meetings the need to listen and engage community, both to shape what's offered, but also to help increase the likelihood that what's offered is what's being asked for or requested. So that kind of mutual response to make sure it's happening. Another thing that we've talked about a lot in our work group is that I hope and I know there's others here on the call, so if I misstate this, I hope you'll kind of chime in and say, no, that's not what I meant. Is that there's a need for culture change, not just a training of clinicians and not just a one and done, but ongoing training and support, that it's important to focus on retention, not just hiring. And many times we've come back to all the training in the world is not going to change the cultures of the places where folks work and provide services. That's part of what needs to change. And part of what this project is about is not just training. It's also looking at trying to help leaders lead this change. And all of us have talked about that being a really important component of it. And also just speaking as somebody who's been in the midst of these kinds of conversations and experiences for a very long time, many of us who are like BIPOC clinicians or LGBTQ clinicians, agencies might get us in the door, so to speak, or hire. But when the conditions of the workplace doesn't support us staying there, we're not really achieving the outcomes we're trying to get to. And so there's lots of deep work that needs to happen over a period of time. And I think also one of the recommendations we're trying to make wherever possible is that we need to be able to think beyond a 1-year strategic plan, a 2-year biennial budget cycle, and that requires long-term commitment. And so part of the effort and hope is that all of you who are on this call today will become engaged in this and think about how and join us in that long-term perspective, not just, okay, we got that training done, check. Okay, we went to this leadership forum or whatever, however it's set up, okay, check. That we really think about the ongoing support and ongoing deepening of making progress towards these outcomes. So hope I represented you all well, team.
Fantastic. Thank you so much for those reflections, Avriel. We're going to move now to Rachel, who's going to walk us through some of the communications.
Hi, everyone. I am Rachel Porter. I use she, her pronouns, and I'm the communication specialist at CoLab at ASHE. I joined the team about a year ago, right as the CARE project was kicking off, and that was no coincidence. Since the very beginning of this project, the team knew that having a strong communication strategy would be crucial to the success of the project. As you all know, CARE is a statewide initiative with the ultimate goal being statewide implementation. So we knew that having meaningful input from a diverse group of constituents across the state was going to be absolutely essential throughout the design process. We also wanted to be intentional about creating pathways for two-way communication so that we weren't just sharing out about the project, but that we were also but that there were also easy and seamless ways for the public to give feedback and help inform the work of our design team at every stage of the process. Can I get the next slide? So with a lean marketing budget, we spent some time thinking about how we could achieve the greatest possible reach while spending the fewest dollars. We knew that inspiring people to share about the project on social and by word of mouth would be extremely helpful in our efforts to cast a wide net and reach people beyond CoLab's usual networks. We developed a few key communications tactics in support of these goals. Firstly, we established what we call our project amplifiers. This involved building up a small but mighty cohort of folks who were invested in this work and had extensive networks to help us get the word out. We equipped them with information and comms toolkits to make it easy for them to help spread the word about CARE. Our amplifiers let people know about our CARE newsletter, which is our vehicle for sharing regular project updates and opportunities to engage in supporting our project value of transparency. And our amplifiers also helped to recruit people for our community sounding board, which was our primary mechanism for anyone with lived or professional experience interacting with our state's publicly funded mental health system to help inform the process. So sounding board members signed up to participate in feedback activities at regular intervals throughout the process, while sharing some information about themselves and their unique experiences to help us understand the lens that they were bringing. So far, we've completed 2 sounding board activities. The first was an open-ended question, what does culturally responsive care mean to you? And the second was an interactive storyboard activity where members were able to tell us what they might think or feel while going through different models of care. All of the information we collected through these activities was synthesized and shared with our co-design team to ensure that they had public input to inform their work throughout the design process. And I just have to say, I know many of our sounding board members and project amplifiers are with us today, and we're so very grateful for your participation in this project. And you are so vital to its success in ensuring that we have a diverse group of people's real lived experiences to inform this work is so important when we're trying to get to an end product that is actually effective for Washingtonians. So can I get the next slide, please? So here are just a few of some of our impact metrics. Thanks to our network of amplifiers and our other amazing partners who have helped us get the word out about I do want to just acknowledge that the true impact of our reach is really an unknowable figure since we have so many partners and amplifiers who are helping share the word with their network secondhand. But we're very happy with the quality and quantity of public interaction and feedback we've received so far, and grateful to our partners for helping us along the way. So with that, I will go ahead and turn it over to my colleague Dominique, who will zoom in a little bit on the partner engagement aspect of CARE.
Thank you, Rachel. Hello again, everyone. For those who missed the opening practice, my name is Dominique Smith. I use she, her pronouns. I'm part of the partner engagement team for the CARE project. And today I'm just going to share a bit more about our partnerships, how we build it and maintain them. So as you look at the slide, here's a few organizations that we've partnered with and had the honor of spotlighting. So our partner spotlights is just showing appreciation and thanks to our partners. So we're very intentional about building, these relationships and community, reaching out to as many people as we possibly can. And as Rachel said, we're really thankful for all of our partners and how they've helped us to co-lead this work. So one of the ways that we amplify our partners is Partner Spotlight. And so we can highlight our partners in various different ways. Our most popular option is a Q&A interview. Our partners have full reins of how they would like to be spotlighted, and they can get as creative as they would like to be. Other options include a written piece or a video behind the scenes, what your day looks like and what you do. So spotlights are featured on the CARE website, our social media platforms, and as well as our CARE listserv. So our outreach strategy, as we started last year, I too joined the CoLab as this project started. And really our strategy was reaching out to as many people as we possibly could, cold call, emails, asking community for recommendations of folks who may be interested in learning more about this project. We've made tons of partnerships, and we've also had instances where, you know, someone may not have the capacity to become a partner or a project amplifier, but later on, you know, they can stay involved and make sure that when they're ready and they have capacity, then they can join our project development. So with that, our outreach strategies, we have presented in various different places, introducing the CARE project. And we've done 4 partner spotlights currently. So for example, my colleague Anna Duncan, who is also on the partner engagement team, reached out to Raymond Gregson, and I see he's on today. Hello, Ray. He is a tri-lead of the Great Rivers FSPRTS, which stands for Family System Partner Roundtable. And we've just built authentic relationship over time. So for those who aren't familiar with the FSPRTS, they create a platform for families and youth and system partners to collaborate and incorporate community voice into decision-making at a regional level. All of the FSPRTS meetings are open to the public. We've also presented at a FSPRTS meeting. So to learn more about Raymond Gregson and the FSPRTS, be on the lookout for his upcoming spotlight. So our partnership with Raymond began with a cold call email, as I mentioned, from my colleague, Anna. Our team then presented to Raymond, and then he invited us to come and present at one of their meetings. And it's just taken off since then. We've had multiple email exchanges. We've invited Raymond to join our advisory group meetings, as well as the Behavioral Health Workforce Collaborative, and just maintaining regular communications and checking in. He sent us resources, recommendations, and we try to send opportunities each other's way as they arise. And to now, spotlighting his work, amplifying his efforts, and bringing awareness to not only the FSPRTS, but outside of his work with his organization, Growing Your Mindset. We've had over 50 email communications, as I mentioned, multiple meetings of checking in, 2 presentations, a recent Q&A spotlight interview. And so this partnership began October of last year. So to learn more about Raymond, be on the lookout for his spotlight. And so really, I just wanted to talk about building genuine partnerships. We honor and respect that looks different for each of our partners. When we receive feedback, we take this back to the internal team and produce ways to incorporate that feedback. And if possible, we then come back and share those improvements that have been made. So as mentioned, we present and introduce the CARE project to multiple organizations regularly. And during a recent meeting, a community partner mentioned the Gantt chart that we have been using during our presentations can be viewed as too academic. And the Gantt chart is a series of horizontal lines that shows the amount of work that we've done, or the production completed and certain time frames and periods in relation to the amount planned over the project development. And so we immediately took that feedback and made changes to our presentation to create a better visual representation of our project timeline. So the partner engagement team is continuing to build relationships with individuals and organizations and community advocates doing related work across our state. Outreach efforts are currently in the process of continuing to connect with Indigenous leaders to understand what work is currently being done in tribal nations and around culturally responsive behavioral health care and how we can continue to learn from this work. We're also building partnerships with non-English speaking communities and always taking recommendations and welcome connections to organizations. We are planning to prioritize based on the intersection of representation and the mental health system and our communities most subject to marginalized and minoritized factors. So we're continuing to work to engage in a further reach across Washington State. However, we understand and recognize that community members are learning about this project at different stages and varied levels of involvement. And it's important to us that everyone interested has access in the project development. So as my colleague Rachel mentioned in the video, there's still time to connect with us and get involved. Thank you.
Hello, everyone. I'm now going to talk a little bit about this process of integrating academic research with community expertise. First, to introduce myself, my name is McKenna Parness. I'm a psychology postdoctoral fellow at the University of Washington and started working with CoLab in, I think, June of last year. So it's been almost a year and a real privilege and honor to be part of this process. So for the CARE project, one of my roles was to lead our team in doing what's called a scoping review of the academic literature on non-specialist services. And the way that we defined non-specialists, we're just thinking about experts in the community with lived experience supporting a child and family with mental health needs. And those folks are then supported to deliver aspects of formal mental health treatment. I conducted this effort along with the support of Dr. Rosemary Meza, a psychologist and youth mental health services expert from Kaiser Permanente Washington Health Research Institute. And we reviewed over 500 research studies looking at different models of non-specialist care across global health literature, as well as some evidence in the United States. And we wanted to be able to present these models to the community to get their feedback, really thinking about how the CARE project is grounded in this co-creation with community, centering the experiences and expertise of community partners. We wanted to figure out a way to present these findings so that our community partners on the co-design team, the advisory team, and the community sounding board could both absorb the information and then provide critiques on these different models to assess their cultural responsivity and the fit for Washington State families. The three models that we ended up finding from the academic literature looked at parent or caregiver peers. So these might be caregivers who have their own lived experience of supporting their child with mental health needs that then go on to serve in a role to support other families. We saw a community health worker model. So these are members of the community who are trusted and may be able to deliver services, but they may not have their own lived experience of having a child with mental health needs. And then the final model we saw were youth peers. So these were youth who, when they were younger, had lived experience of navigating mental health and behavioral health challenges, and now are at a point where they can support other young people through more formal services. The way that we decided to present these different models from the academic literature to the community was through storyboards. These were visual design tools that we hoped could walk the community partners through different models of care. They're basically presented as comic panels you can see on this slide here. And they show either a caregiver or an adolescent seeking mental health care. And then they have different folks who might be from the community who are supporting these efforts and getting families connected to care. One of the greatest privileges I had was working with the co-design team to shape the storyboards, talking with them about the language that was being used, getting feedback on the design and making sure that these were accessible and that folks, when we shared them with the broader community, would be able to provide feedback and really critique these in ways that would be meaningful for the CARE project. And as a researcher with my own blind spots and limitations, I felt these conversations with the co-design team were just so transformative and critical for the design of the storyboards. So we presented these storyboards to the community sounding board using a survey to gather feedback on these various models of care, asking them what they thought could work from these models being presented, what was missing from these models, and what were alternative approaches that may meet the needs of Washington State children and families. And another step in this process is now conducting community listening sessions to guide the project, with an emphasis on getting organizational input from non-English speaking groups. So we have the privilege of this effort being supported by Dr. Sumaire Mirfaiz, who is the founder and executive director of the New Americans Alliance for Policy and Research. And throughout this process, she has been so integral in really giving feedback and making sure that we're uplifting the voices of non-English speaking youth and families to make sure that our services will be culturally responsive and address any language barriers that currently are a huge challenge and limitation in the United States. So throughout this project, we've been navigating this balance when integrating academic research with community expertise. And as a member of the CARE project, it's really been wonderful for me to grow and learn in that process. Now I will pass it back over to Dr. Sarah Walker, who's going to talk a little bit more about information synthesis.
Perfect. Thank you so much. So this is a bit of an overwhelming slide, but also if we're trying to convey the amount of information that is coming into this process. So when we do co-design, we work with our co-design team partners and our advisory board to identify who is it that we really need to hear from, and what communities, what sources of knowledge. We gather that information, and then we work collaboratively with our teams to integrate it, synthesize it, and to take away key learnings from it. So this is just to give you a sense of some of the information that's come into this process and our way of working to try to drill down to the key design principles that will then guide all of our product development. And I'm going to say one more word about implementation teams and then hand it over to Spark, the next slide. Another really delightful part of the CARE project has been getting to know and work closely with kind of innovation catalysts from our accountable communities of health and the Behavioral Health Institute across the state, working with Greater Health Now, Better Health Together, the Northtown DCH, Spark, and BHI, covering most of the, quite a few regions in Washington state. And what the implementation team's been doing is running listening sessions, particularly around community member workforce roles and culturally responsive care with their own communities, both community mental health providers and consumers and workforce members. And this information is going to be extremely critical as we further define particularly the community member workforce role and start to kind of come to some agreement about the best structure for that role, the best training for that role. And then we're having ongoing conversations with partners at HCA to sort of be in alignment and in conversation about potential policy priorities for maybe credentialing or paying for an expansion of those roles. So this information, right now, we're still in information gathering phase, but starting to set the stage for really thinking about what this workforce role would look like in Washington state, and learning just a ton from the energy and the brilliance of these partners and their work on the ground. So next slide. So I'm very happy now to hand it off to our partners at Spark, Carolyn Cox and Gabriel Hamilton. If you guys want to come on, we'd love to hear your thoughts about the process, reflections, and where you think this effort needs to go to really serve children, youth, and families in our state.
All right, so I'll introduce myself and I'll let Miss Carolyn do the most of it. So my name is Gabriel Hamilton. For those of you who don't know me, I'm a youth peer specialist. I labeled myself a peer-to-peer professional. I think we're all peer-to-peer professionals in this room. I think I just like that a lot better going through this class because we're getting to know each other at a peer-to-peer level, and that's what we do as peer specialists. I've been doing peer work for about 5 years now. And I am also a youth or the statewide youth tri-lead for the Family Youth System Partner Roundtable at the state. We're doing a lot of work to get some youth engagement involved over there. And yeah, I've just been working with Spark for almost a year now. I really appreciate the work that Miss Carolyn does. And I'm just going to let her speak Yeah, so.
That we do.
That we do, yes.
That we do.
Said you were free.
Hi, my name is Carolyn Cox. I am the executive director and I guess you could say person who created Spark. And I am just super excited to be here. I've been working in a peer role for 20+ years, even before we were paid through Medicaid. So I've seen a lot. My family went through services. I've been through services myself. And so I come with a lot of lived experience, and Spark is also a training entity with the state for certifying peer counselors. So we're super excited about that. So we started right at the beginning with CoLab, and I was super excited to start working again with Dr. Sarah Walker, because actually my career began working with Dr. Sarah Walker on a project. So this is awesome to be a part of this, but I think, Gabriel and I have done a lot of talking about this, and we're super excited that we're looking at services at a cultural level, because there are a lot of steps that need to be taken to make services relevant and culturally responsive to communities. And so I started out in an agency, but I now work statewide and have had the opportunity to work with many agencies. And, I think that peers, there's a lot of work and stuff going on around peers in the workforce. Gabriel and I both have been really involved in some of the legislative things that have been going on, but CoLab has been an extremely, I think, important piece for us with our voices. I know I have felt that because sometimes, we don't always agree on things, but I think what I love about this team is that we are absolutely wanting to connect with everybody. And I love the perspectives that come out of this group, because we all have different perspectives. And what we're hoping to see in the future with this, because we're excited where this is going, is looking at how do we train a workforce to not just look at being culturally responsive, but also include the peers that come alongside families and youth, and really help us partner together to see how services can be done together and in tandem with one another. Because as we know, peers are folks that have lived experience, come alongside folks and youth, because we have youth peer partners, especially with WISE, wraparound with intensive services. And we need to start building that workforce, but we also need to start working together, because I got to tell you, I absolutely love therapists. I know some great ones, but we also have to recognize that we come with a skill, y'all come with a skill, and we got to start putting those skills together. And how do we work better for the families that we come alongside and work with? Because I think we all want outcomes of stronger, healthier families, and not just for those, for everybody, and ultimately having that culturally responsive approach, and making everyone feel like they have a voice and a choice in their care and how it goes. So we're super excited. Gabriel, do you want to add anything? I know you said I would speak, but I want to hear from you.
Yeah, I just want to thank, like I've talked to Miss Dr. Sarah Walker, and just everyone when I'm in these groups. It's a humbling experience to be in a group with so many professionals and so many eyes and ears that have seen a lot of this work and are trying to do a lot of great are doing a lot of great things. I I say that because I got in this at 18. I was one of the first youth peers in the Tukwila area, so that was kind of cool. And I've only had opportunities to be in rooms like this because of people like Dr. Sarah Walker and Miss Carolyn giving me opportunity. So it's a humbling experience. But what I would like to say is just, yeah, I mean, I know the eventual goal is to help build and grow and work peers in tandem with therapists and have trainings like that. And I think the most important part is that incorporating peers. And that's where I see it going, is if we're going to work together with the professionals. We talk a lot about it in our training, but we're here to empower and enrich and encourage and grow the mental health field. We're not there to take and steal jobs. And I think that communication sometimes gets missed just because, you know, I don't think there's a lot of communication going on along how a peer's job works or what we do and what what you guys do and how this can be actually fruitful to a agency and not a challenge or a competing with the agency. So I really just appreciate that the work here is moving forward toward that, because I think it's really needed, and it's been needed for a very long time. It sounds like that communication between peers, communication between roles, communication between how do we work together, even if we don't agree, you know, even if we disagree and agree, and even if we don't agree at all, but how do we look at the overarching scope of the work, which is why I really love this, is that you're looking at, it's not about us, it's about the people and the peers we're servicing, the families we work with. It's about how do we get them the best care, and how can we, you know, get past our egos and our own disagreements and frustrations with one another. Because working as a peer, I have had to, you know, swallow a lot of that and be humble with someone who may not see the same way I do at a professional level. But how do we still agree that the person in front of us is the most important? So I just really appreciate all you do, Dr. Sarah Walker, and the team you guys have. You guys are absolutely amazing. We have had the grace and benefit to work with Anna and Dominique, and they are phenomenal people. So I will always give them shout outs. And every time I'm in a room like this, I will always give those who have allowed me to be here shout out. So I appreciate all the work you guys do, because it is a humbling experience. And yeah.
Well, I'm feeling really humbled. Thank you so much, Gabriel and Carolyn. We are so grateful. I'm so personally grateful you're involved. Thank you for your wisdom, your expertise, your voice, and your guidance. It's just, well, couldn't do it without you, literally. So thank you. So I saw I was just spotlighted, but I am actually just going to hand it off again. Again, extremely grateful that we have Dr. Benjamin Danielson to be providing also some commentary and reflections, just some personal reactions to this presentation, the effort, and given his expertise in the area of health equity and youth wellness, I know I'm personally very eager to hear what he has to say. So, Dr. Ben.
Thank you very much for the chance to say a few words, but I'm also a bit at a loss of words, because I think we've heard from the experts and I'm so inspired by that. I think people like me get over-labeled for expertise when the wisdom and knowledge has been out there in communities all the time. And I think that's part of the magic of this approach that CoLab cultivates and plants seeds for, and knows when to get out of the way of, and when to pivot and shift into what's happening for folks on the ground. I'm just really inspired today. Gotta say, I kind of needed this. This is a heavy day, especially in the Black community, and just needed to be present with you all in community. I'm also surrounded by people who are all like my heroes in this work and have been doing this work for a long, long time. And I honor each and every one of you who's been putting your efforts, your heart and soul into this for such a long time. I think that I feel particularly drawn to how this approach seems to do the things that maybe we've talked about trying to do, the opportunities we've tried to lift up in centering communities and being really driven by the voices of those most impacted in work, through a manifestation of a vision. And I'm very inspired by that, especially just the idea of cultivating opportunities to listen. It can seem like such a simple step or something so assumed and taken for granted in work. And the depth of intensive effort that goes into actually true, meaningful listening, it requires a model. It requires a deep commitment, and you got to prove yourself in that work. What I'm always struck by when I'm interacting with Dr. Walker is like you could just feel this love, right? Like the folks that have worked with her, they're coming from a place of like, this is fam, this is my loved one who is helping to advance this work. When you get to relationships at that level, things move in a different way. Opportunities arise in different ways, and I think that that's I don't know. We need to cultivate all of our abilities to express our love in the moments that we're expressing our best experiences, expertise, and named and earned knowledge in this work area. I kind of want to get to hearing other people's thoughts, because I'm also noticing that even in today's gathering, people are making connections like during real time during this. And that's really exciting to me, that ideas are being cultivated and sparked, and like, I want to find out more about this and I want to connect with that. It's funny that that's what this has been all about, and yet it's continuing to happen even in this gathering. This is hard work, and I know each and one of us goes through times when we feel extremely siloed, really alone, like we're giving everything we've got for this work, and it feels sometimes like we're not connected to other people who care as much as we do, who've put the kind of effort in, and to have collaborative opportunities where you're just seen, just absolutely seen, where your experience is understood, where there's space for your voice, and there's space for people to appreciate you and share gratitude. I don't know whether that fits into most grant proposals or policy documents, but the opportunity to be seen is one of the greatest moments that we have with each other, and it's where the work begins and where the work ends. Pulling us out of silos is so important, and I'm so appreciative of that. I also love these voices coming up. You know, I hear this like, respect my skills, coming from Sparks, and I just like, that is just what we need to be talking about and hearing and understanding. I hear perspectives like, I am more than my diagnosis. I am so much more than a medical label or some diagnosis or some list of problems that someone else wants to describe me by. The opportunity for that to be centered in a conversation like this, that's the kind of work I want to be doing and be close to. I'm so also humbled, like I've heard you all say, by the voices in this work and the ways in which it's happening. I know it's a little bit early, but I would get on the campaign trail for Gabriel for governor if that's going to be happening soon. But I'm just most impressed by this idea of how to work well with instead of not challenge or compete with in these endeavors. It's just something that I think we all need to center in our efforts a little bit more. And I just find it extremely moving. I want to hand it back though to Dr. Walker to get us into any more discussion and Q&A, because I don't want to miss any of that. Thank you.
Thank you so much. I am feeling so incredibly grateful for this huge team that is part of pulling this together. And I want to also echo again Avriel's comments from the beginning, which is just this really is about trying to bring together as many voices, perspectives as we can so that we don't miss something important. And it is everybody willing, who have been willing and who may be willing in the future to come in, share that voice, take that risk. Because as Gabriel and Carolyn are saying, you know, we have different perspectives and it can feel like a risk to come in and share yours when you don't know how it will be received. And then, you know, Dr. Ben, it's if we don't do that, we're not going to learn. So just such immense gratitude for the folks who have taken those risks, who have come into this conversation, who continue to be, and who may be considering it. So just so much gratitude for you all. So we'll open it up to discussion, Q&A. You can put your questions in the Q&A box or in chat, we didn't really run this with the team, but if you raise your hand, we might be able to call on people who might be able to monitor that as well. So want to open it up to you, your reactions, questions, hopes, critiques. And I see Sharon has a raised hand. And so I think you can probably unmute yourself, Sharon, and please share.
Good afternoon. Oh my God, you guys don't really know how important this is. Well, I've been raised with a mentally ill mom, and I have no siblings. And now I get to be part of change so that my kids don't go through this, so that my grandkids don't go through this. This is so important. I think the COVID really woke us up, because I think even people who wasn't aware of mental illness are now aware of mental illness. Unfortunately, it had to come out that way, but it did. It awoken us to be aware of something, and not it's not the person, it's the disease. And we really need to let people know that I am not mental health, it's the disease that I have. I can still do everything if I have people like you, a team like you that provides me with hope, that I can give hope to the next person. I want to thank you so much.
Thank you so much, Sharon. That is powerful. Thank you. Other questions or comments? I feel like I just lost my Q&A box. Lori.
Thank you so much. This was a great presentation. Thank you. It's informative and inspiring and exciting. I do have a question, because I'm always trying to figure out how things might or might not fit together. And that is about the legislation that passed 2-ish, maybe 3 years ago, that has to do with health professionals needing to get continuing education related to culturally responsive services. And so I'm just wondering if your work has intersected at all with that, and if so, how, and if not, does it make sense to do so, et cetera?
Fantastic question. I believe I know, so I hope I'm not going to misspeak here. We connected with a group, I believe there's a group at Harborview that has one of those contracts to be the trainer for that ongoing culturally responsivity training. And we reached out early in the process. And right now we're in the process of, now that the co-design team, we wanted to make sure we were really envisioning culturally responsive principles from the co-design team first before going to sort of training entities. And then we're inviting, pulling together a meeting for requests for information. And we've been identifying a number of organizations that could serve as training partners, training entities, both sort of as a central training entity, and then maybe hubs, train the trainer entities. So we will go back to that organization we talked to at Harborview, and then potentially we may need to identify more. But there are a number of enormously talented trainers, clinical trainers out there. It's just been a delight getting to know who all these entities are. So we'll go from the request for information to request for proposals. But to your point, Laurie, it'd be nice to sort of align initiatives so that we're not duplicating or having parallel process. So thanks for the nudge on that. Other questions or comments? Are you all in a just state of complacent bliss, as I am after listening to all of our speakers and commentators and inspiring people? Excellent. Let's see, Betty, and then Betty Jensen, if you want to unmute, go ahead.
So the way it was presented about the culturally responsible, what it did is pissed a lot of people off. The way it was presented, as an assumption that you're not culturally responsible. And I, for one, was really pissed off by the way it was presented. At no time have I ever been culturally irresponsible. And I ask questions, I don't make assumptions, because way too many have been assumed about me, and I don't like it. So I can tell you by the way it was presented, a lot of people are going to turn it on and turn off the volume and get credit.
Betty, that's incredibly important information for us, as our goal is to reach, throughout Washington state. And it may be that there's a number of things in this training that people are already doing extraordinarily well. So we do not want to project that people have been failing at doing their work. So thank you so much for that information. It's really important for us to hear. Thank you.
You're welcome.
And then I saw, I think it was Mark, but it said Joanne. Mark, Mark Fadul, were you hoping to say something?
I was. Thank you. Can you hear me?
Yes.
Good. Once again, anytime, this was almost like church for me. Like it was a testimonial of humanity really guiding us, relationships, trust, etc. My question is, looking at all the amazing effort to hear community voices throughout the state, anecdotally, have you guys seen how connecting with different agencies and different groups has had some type of secondary positive impact, that they've formed relationships even outside of collabs?
I love that you're asking that question. I might just ask Dominique to think about if she wants to share anything that she has seen, or anybody else from the team. I'll note that that is actually one of our interests in trying to understand better, and actually gives me an opportunity to kind of plug that we did send something out to the advisory team to let us know if they have been making connections outside of the CARE project process around this. So that's probably what I can share, Mark, to that question. I wonder if anybody else on the co-design team wants to speak to anything they've seen where folks have started to connect, maybe outside of spaces that we're specifically facilitating. And if nothing's springing to mind right in the moment, that's great. That's fine. Anyone from the co-design team? Yeah, great question, Mark. It is one of our goals. I can say that. Let's see, I think I saw Jocelyn Bell and then Lori again. Jocelyn? Or Joycelyn, I'm sorry.
Yeah, no, you said it right the first time.
Oh, okay.
It's Jocelyn, yeah, but it looks like Joycelyn or Joycelyn, so no problem. I just want to thank you all for like the collaboration and the work and the dedication, and I'm sure like volunteer hours that have went into creating this effort. I want to also acknowledge and like show appreciation for others' opinions in regards to what you guys have done. And I just want to state, like, as someone who was born and raised in Seattle, Washington, moved back and forth between there and Oregon, that y'all are moving in the right direction for populations that, basically are impacted by the social determinants of health and everything else that comes along with it, the community violence, gun violence, human trafficking, and so on and so forth. And so I just wanted to say, like, I just took like a training about cultural responsiveness and competency. And it's not like just a destination or stagnant. It is a process. And so that's why I feel like it's necessary that we keep bringing that to the forefront, because you just don't arrive, just like how our population of youth look differently than they did 10 or 15 years ago. We have to adjust to respond to those things as well. So I just want to thank you, and I want to thank everybody else for being here, and I hope everyone has a great holiday weekend.
Thank you so much. And thank you for that reminder. It's so important, such important framing for what this is, what the co-design team has been articulating as well. Thank you. Lori.
Thanks again. I think it was during the Spark presentation, it was mentioned that they can bill Medicaid. And I am constantly trying to better understand how peer reimbursement can take place. So can you just say a little more about that?
Carolyn, did you want to take that one around billing Medicaid? Or is
Sure. Yeah, I can. Can you, sorry, they're eating lunch out there, so they're being noisy. What was the question again?
I was just curious. I think you or Gabriel may have mentioned that you can bill Medicaid for your peer work. And so I'm always trying to understand how that works.
So right now, there is legislation that went through. However, we just learned that the governor vetoed a lot of it. But there are some things that they're going to be doing around how that's done. But as it stands right now, if you work for a license, you have to be a licensed mental health or behavioral health agency or organization in order to bill for Medicaid services for our work that we do. And I worked for an agency for almost 9 years and got paid through billing. The agency billed for the Medicaid for the services that I provided as a peer. Now for Spark, we are a peer organization. However, how we work is we are not a licensed agency. So we don't provide services, we provide training. So any money that we get at this point is from contracts or grants, things like that. So we're constantly writing for grants and things like that. We are a identified training entity for Washington State for the certified peer counseling certification. And what I love is we just came off of a contract. In fact, this is one of our last classes for the contract cycle that we're doing right now, that focuses on BIPOC population. And it's, oh my gosh, it's just been amazing. We have very diverse trainers on our team of many different cultures and ethnicities. And we're just super excited to show people how we can all work together and do this work. So I hope I answered your question though, around the billing piece.
Yeah, thank you. That was really helpful. Thanks.
And there's some additional, I think, info in the chat. So thank you. And Sharon has a question about becoming a certified peer counselor. So I wonder, Carolyn, if we can connect you to Sharon. I think you're the expert.
Absolutely. I'd be more than happy to have a conversation with you, Sharon, about that.
I apologize. I am peer certified. I meant the WISE training.
Oh, WISE. Got it.
I'm really interested. I'm heavily in the community on purpose. I think that is my purpose. Because, oh my God, you guys have just got my light bulbs just shining right now, because I want to work collaborative to bring more awareness about mental health. I think it's very, very important. I think it will make a big change in all communities.
Fantastic. Well, we can follow up with you and make sure you get to the right person, Sharon.
Thank you.
All right. I'd like to invite maybe one or two more comments, questions. This is great. We're sharing info. We're all learning. All right. And just noting, thank you, Dylan. Comment around connecting with a crisis response improvement strategy. So we will do that. That's really appreciated. Okay. Well, I want to respect people's time. I'm sure you don't mind getting a little time back during sort of the noon hour. Again, just immense gratitude to all of you who are contributing your time, your wisdom, your expertise, your sort of courage to help us continue forward with this. Please get in touch. There's been a few links in the chat around how to contact our team to get involved in various ways. And again, just thank you for being here today. We appreciate you. Have a great day and a great long weekend.